Chesterfield and Richmond school boards have already made the decision to start the school year virtually. Henrico has not made a decision yet, but their superintendent is recommending a virtual start to the year. However, the head of the Richmond and Henrico health departments told us today that's not necessarily what he would suggest based on the research and the data.
Citing data from daycares in the United States and schools abroad, Dr. Danny Avula said evidence suggests kids under the age of 10 tend not to drive the transmission of COVID-19.
They can get COVID-19, but when they get it, they typically have very mild disease or asymptomatic disease.
But kids over the age of 10, well, that's a different story.
Now, older kids, adolescents, do tend to spread more like adults.
For those reasons, Dr. Avula says school systems need to take a very nuanced approach when deciding whether to reopen.
The nuance is in, what age is your child, what dynamics exist for the number of kids, their ability to adhere to social distancing guidelines.
But what specifically does Avula recommend?
I do think that some combination option of in-person and virtual still makes sense. I think there are ways to do in-person safely, but I also absolutely understand that you've got to look and listen. I think one of the things that the Richmond leadership did really well is that they listened to their families, they listened to their teachers, and used that to drive their decision making.
The number of cases in the city of Richmond are up from about 15 per day 2 weeks ago to 25 per day. Richmond's percent positivity is now up to 7.4%, well within the 10% threshold experts recommend.
Now, although cases are only slightly up here in Richmond, they are surging, Dr. Avula said, in the eastern part of the state. So Mayor LeVar Stoney wants folks here to remain vigilant, to continue to wear your mask, social distance, and wash your hands frequently.